Looks like a all righty. And do I also, you'll take care of the waiting room, I guess. Yes. Okay.
Yes.
Well, it's so good to be here, ladies, and maybe gentlemen, I'm not sure. But I just wanted to start off first with if it's okay if I share my screen, I'm going to talk a little bit about my journey, and then yeah, and then actually get down to breast cancer. So I called it, she get it from her mama because I do actually have a hereditary breast cancer, that BRCA2. But this is just a photo of some of my journey. The one on the bottom right is actually before I was even diagnosed. I used to, support, run, do different things for breast cancer awareness. And then I would do talk shows and do radio spots. And then I had the fate of becoming a patient myself. So I wanted to get started with, this is some photos of my grandmother and I vividly remember my grandmother just growing up with her. And one thing I noticed as she would bend over to hug me or to embrace, sometimes if I saw her as she was getting ready, I noticed this asymmetry. I noticed this, bulge on one side and a flatness on the other. As a little girl, it shocked me. It was, like, is my grandmother okay? Is she okay? Is her body? And I wouldn't really know what that all meant, until I would become an adult. And, to learn that my grandmother had a mastectomy. And just from a very young age, that vivid imagery remains in my mind. And so then we have an aunt of mine, her name was Anna. And she was diagnosed and had the sad, unfortunate situation that she was actually diagnosed when she was carrying her youngest son, Jose. And she had to make a difficult decision, continue the pregnancy or, take d disruptive chemotherapy and do things that could harm the pregnancy. She chose to allow her son to live. And sadly, she did succumb 2 years after he was born. And then I had an aunt, my tia Diana, and she in our family, when she migrated from Panama, she came to our home in New York. And, it was so much big commotion. We were so excited. And come to find out, she would start treatments at Sloan Kettering. Again, I'm a teenager. I'm seeing women in my family, and I'm just thinking, wow, maybe this is the norm. Everybody must go through this. And maybe one day I'll go through it too. And so I just figured this is what happened to women. And she would live, and she is currently alive today. My grandmother represents proximity to me in that, my mom, then my grandmother, that is that close. An aunt represents, sadly, tragedy. Again, in the middle, that's my aunt Anna, who passed after her son, she made that decision and of self-sacrifice. And my aunt Diana, who still lives to this day, and she's an overcomer who survived the disease. And so I say all that to say that in our family, we learned that most of the men on in these photos, all of them actually, were diagnosed with prostate cancer. And the women, such as well, I'll get to my mom. She's next. Um, but the aunts were diagnosed with breast cancer, and the men with prostate cancer. And so next, I go to a cousin, and her name was Perla. And this is when it gets closer to home because now she's in my generation. You think, okay, everyone's getting cancer, but those are the old people, it's just old people's disease. No need to worry about it. And then Perla. And, she was in her late 30s, sadly passed away at 45. And so one of my cousins that we hung out with, and that's me, and that is her. And yeah, we just, grew up together, going in Panama, going back and forth. And to have someone your age now it gets very, very scary and sobering. Let me keep going. Sorry. So next would represent, this would be the dagger. This is my mom. And with mom, it was different because mom was very precise. She was a nurse. And she was very precise with her screening. She would say every year, okay, she understood what was going on. So she would get her mammograms every year and never found anything. But sadly, one day she would begin to feel bloated and she would feel like her abdomen, she was eating and she was feeling so full. And just a small bit of food, and she would get so full she couldn't eat. Sadly, would represent that she would go on to be diagnosed with ovarian cancer. And so we have a family filled with breast, and then we learned ovarian cancer. And in that time frame, we learned through my mom and her testing that we are hereditary carriers. And now hereditary doesn't represent much. It represents about 5 to 10% of breast cancers, but we are in that minority. And so that would kind of go next. Next is me. So that's me. And during the pandemic, I was an essential worker. I was working hard, was doing all the different things. And during the pandemic, it was really difficult to get mammography. Mammography is really difficult to do anything because the pandemic kind of kept us, away from that. However, one day, day that would never change in history. History of my course of my life is the weekend of July 4th in 2021. So the pandemic had just ended, and in 2021, it was a weekend. We were just excited. The family we were going out to have ice cream, and I was taking a shower, and I would be feeling drying my body off, and I felt a lump. And in that moment, I knew that something wasn't right. And of course, one thing leads to another. I am diagnosed, and that was 3 years ago. Sorry, 4 years. I was diagnosed 4 years ago, but everything from all the different treatments, the radiation, the surgeries, etc., ended in 2022. So that's why I say it's 3 years. I'm a 3-year survivor from this disease. So that's just me. I just wanted to give a brief overview of who I am and what is going on with me. And how I come to you guys today. So I appreciate the just being here. So we're talking about breast cancer. Breast cancer is, they say 1 in 8 women will get diagnosed with breast cancer. So that means, look to your left, look to your right. You know how you're in a big auditorium. Somebody next to you, someone that you know, is probably going to be diagnosed with breast cancer. And that's why this is so important. And what do we know about it? That it's the most common site of breast cancer. And the numbers are looking for 2025 that, just of course the data and they're extrapolating it, that about 316,950 new cases in this year alone. And that there's about 60,000 new cases of ductal carcinoma in situ. And what is that? That is stage 0 breast cancer. Before it breaks through and becomes invasive, it starts as that, so stage 0. And that has an excellent prognosis. Yes, it is also seen in men. Only 1% of cases do represent men, about 2,800. And about 2.3 million women globally. So it's not just a USA problem, it is an entire global problem. It represents the second most common cause of cancer death in women, and is the leading cause of death in women age 40 to 45. And let me see. Okay. Um, like I said, 1 in 8 women, about 12%. And the reason it seems like the numbers are going up is possibly that it is, but also there has been such good technology in terms of mammogram, 3D now. It used to be a 2D mammogram. Now we're recommending a 3D mammogram because it just is more vivid in all the angles and the ability to see the architecture of the breast. That allows for earlier diagnosis, seeing the tumors at a smaller size, meaning that it's an earlier stage, and of course, better survival. And I missed this. That's not spelled right. Sorry. So what about screening, right? People will say, well, like I mentioned before, 85% of people don't have a family history. For people with family history, we're a different category. We're talking about starting screening, let's say 10 years before the youngest person in your family. So if I say my cousin was diagnosed at 39, ooh, even starting at 29, screening. As an OBGYN, yes, I have diagnosed people with breast cancer in their 20s. It is very rare, one in about 1,500, but it's possible. It does occur. So like I meant, then the other thing is monthly self exams. So one thing that's very important, and I have a slide, the next slide will show the self exams, but it's very important that you do your self exams after your menstrual cycle, after the period ends, because sometimes your breasts are very tender and sensitive and could be, a little bit more lumpy and cystic during the menses. So it's better to wait after. Also, beginning at age 40, there used to be some doctors will say, well, every other until age 50, starting 40, but every other year. But we do see a good number of people being diagnosed. I currently have two friends in their 40s. And I, of course, am myself, so I do recommend annually instead of every other. Um, and then sometimes you can set a reminder on your phone or decide that every October, because we know this is where we are. It's October. This is the month that we all get excited. We wear our pink and we are, so please figuring out a way that you don't miss it, that you don't skip it. Again, when you do have the family history, it's important not to forget ovarian. And that's what happened in our family. Remember, I told the story of my mom. That was a shock. We just figured mammogram, 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 mammogram. But if there is a family in your family, someone's had ovarian, then also it may mean it's important to talk to your doctor about it because it may mean that you may need to start screening for breast cancer earlier, sometimes with MRI and other technologies that might be helpful. Other thing is that, we call it screening. It may be once a year. You say, oh, I'll just wait. If you feel something, please do not delay. Do not put it off and say, oh, well, the mammogram's around the corner in a few months. I'll just wait until October. It's already scheduled. No worries. No, yeah, no, you should be concerned. You should be concerned and you should let your doctor know if you do find something and don't just wait. Alrighty. And so here we have the actual self-breast exam. I think what it's trying to show here in this photo is that it's very important to wait until, again, 2 to 3 days after your periods ends. That's the first part of that. Okay, that's the calendar. So let your period pass and then wait 2 or 3 days and then start to do the examination. It's important to raise your arm, whether you're in the shower or you're lying flat in the bed. Okay, and then you're going to use the pads, the fat pads of your fingers, and then you're going to decide you can go in a circle, we call it concentric circles, which is circles upon circles, going from the outermost to the innermost. You want to go up to your collarbone or your clavicle up here. You want to go out to the axilla or the armpits. And you just want to make sure you're getting all of the area. You can go across in like a square, like a lawnmower pattern, across, down, those that cut their grass, down, across, if you do that, or your husbands or whoever, your kids do it. But that's another way as well. Okay. We talk about doing it in the lawn, but the goal is to understand. You say, well, what most my patients say, well, what am I feeling? I don't know what I'm feeling. I'm not a doctor. That's true. But what you're trying to get an idea of what do my breasts normally feel like? Last month I didn't feel this little marble over here. That's weird. What is that? I remember for myself, and all I can do is tell you about what I experienced because that's, my testimony. But I can remember that I would sometimes feel under my armpit, and I remember I would feel this little like pimples, and then I'd squeeze it and little stuff would come out, and I'd be like, what's that? That's weird. And it took me a while before I said, this needs to be checked out. And imagine me, a physician. So it's so important that we don't think that it can't happen to us. We don't think that, oh, it's just, I love when my patients are so concerned about the little changes in their body, the little details. We must pay attention. We must get to know our bodies because it could definitely, save a life. And so we talk about the symptoms. So what are we thinking about? What are we looking for? Absolutely a lump. I feel like that's the first thing we tell someone, tell people. Everyone knows, look for a lump, feel for a lump, okay? In the breast or the armpit, okay? The armpit is important. Don't leave that out. The other thing is, just if it feels thickened or swollen, you look at it, make sure you use a mirror also when you're looking at your breast because sometimes, you're just, your face is this way, you're feeling, maybe it's like, okay, I think, but if you're looking also using a mirror, you can see things like a little pull, a little dimpling, a little indentation, a little inversion of the nipples drawing in, and different things that you may not necessarily see or realize, without the aid of that mirror. Definitely if the nipples are getting flaky, if you're, again, I said pulling, and then any nipple discharge, or especially blood. Okay. All right. Some day of tips with mammograms is so important just to know, just little hints because things that you just may not know, you may show up. It's important to know that with mammograms, you shouldn't do it the week before or during your period because the radiologist gets better results if it's after your period. And also, that your breasts are less tender and they just can see better some of the anatomy. The other thing is that on the day of, be careful not to use deodorant. A lot of the stuff, it cakes up there and it shows up as things, artifact, we call it, on the x-rays images, perfumes and powders and stuff that can cause calcifications, the appearance of things. And so that's important. And then also, just for your comfort, because you're going to be asked to undress from your waist up, make sure you're wearing a skirt or pants, not a dress, because now you got to take your whole dress off, and that's awkward. Um, Alrighty. So with mammography, we're talking about this is an important graphic because it just, the realities are that I'm looking at women here. A lot of you are on, and you've all probably, many of you have gone through mammograms. You know that out of 1,000, right? 100 out of those 1,000 will be asked to come back because we saw something. They saw something, and out of those 100, 61 of them will say, you know what? False alarm. It was nothing. So that tells you something, right? 6 out of the 10. So majority of the time, out of those 161, we wouldn't have found anything. So it's important to not panic. Immediately as you get that phone call, of course, our heart races and our mind is going a mile a minute. We've already predicted our entire lives and we see our funeral, with that one. Don't do that, okay? Please breathe, go for the second imaging because 61 out of 100 will be just nothing. All right. So out of those that remain, so I guess the 39, right? 20 out of them will find something that is not likely cancer and be asked to return. And so you guys know that, right? The anxiety that builds up. We say, oh, everything's fine, but we want to see you back again. And like, well, if everything's fine, why do you want to see me again? Well, we want to just monitor it. We want to make sure that this, maybe fibroadenoma, this benign finding is not growing, it's not morphing, it's not changing. So that's why. So breathe easy. It's okay. See you back in 6 months. 19 now will have a minute need to have a biopsy. 19 of all these people out of the 1,000 will need to have a biopsy, and 5 will be diagnosed with breast cancer. Okay? So that's why it's important to have these things. It is also important to say that 10% of breast cancers are not found. So 10% of the time, the mammogram, and that can be for different reasons. I'm going to talk about that next. Okay. And so, yes, it's true that they are uncomfortable, but remember, that discomfort is just for a short time. Okay. It is true that that is the case, but just keeping in mind, we're keeping perspective here, right? Someone like me that's been gone through all the treatments and this and that, if you say, the discomfort for 20 seconds, 30 seconds of a mammogram, I will take any day of the week over, radiation, chemo, surgery, all the different things. All right. I mentioned already that the 10% sometimes don't pick it up. And then, of course, we talk about dense breasts. And what does that mean? That means their breasts are packed in. The younger you are, right, from younger to older, your breasts have a lifespan in terms of the way that the cells are arranged. Okay, so that's why they oftentimes mammograms in 20-year-olds, even though we can diagnose it that young, sometimes they're just not as, sensitive. They don't pick everything up because the cells are just packed in. And I'll show you some picture. The next picture is going to show that. Definitely, like I said, if you feel a lump, talk to your doctor. And then oftentimes when they have you come back, it's because they want to take more angles. Sometimes they want to add an ultrasound. Sometimes they want to add an MRI, but they want to take more views to really, really figure that out.
Yes.
Okay. So,
Yes.
and now when we talk about dense breast, I'm sorry, you're saying something? Okay. Yeah, so with that dense breasts, I feel so we go down here, the bottom right is let's say in your 40s, let's say 30s, okay? Then we get a little denser, and then we get here, which is less dense, and then we get really almost fatty. So as you age, your breasts go from very dense to very fatty and less dense. So the tissue, so you can absolutely see a cancer if it shows up on here much easier than in here because it's kind of clouded and it's more difficult to see. And now I'm just talking about stuff that radiologists deal with. Okay, so what is cancer? Cancer is it's basically cells. We all have normal cells in every part of our body. Every single cell in our body, obeys certain rules. Cell death, apoptosis, meaning that the cells grow and then they stop. There are programmed messages within the DNA that allows the process to happen smoothly. But one of the things that happens as we age and as there's more defects and exposure to environmental factors like smoking and radiation and different things, those processes in the cell don't happen as smoothly and as easily. And that's where we start to see cancer growths, overgrowths, and changes in the nucleus, and just it's irregular now. The boundaries are not nice and smooth and circular, they look very irregular. And so that's what happened when someone gets cancer in any organ. And today's topic is about the breast. So the most common is going to be the invasive ductal. So we think about the architecture of the breast. We have the ducts, and then we have the lobules where the milk is produced. The lobule is like a bag, and then the duct is like the handle that creates that I think better is the picture, right? So they're just branches, and at the end of the branch is a big sac, that's the lobule. Okay, so the actual branches, the ducts, is where the ductal carcinoma begins, and then in the bags where the milk, we're talking about milk production, of course, or the breast. That's where that's lobular cancer, breast cancer, and so those are the two common types. Let's go on and talk about risk factors. And with risk factors, we talk about what you can control and what you have no control over. Okay? So I like to talk about the things that we can control. We can control our physical activity. We can control whether we're overweight or obese. We can stay, active and healthy, keeping a healthy weight. Okay. We can also control whether or not we're using hormones. Are we going to take hormone therapy for over 5 years? Are we going to take a lot of birth control and different hormones that we're exposing our body to or not? Those are decisions that we all have to make. We can decide, even though this is a little controversial, but we can definitely decide we talk about things like not ever having pregnancy and then pregnancy after 30. Okay, so one of the things that exposes us, okay, to more breast cancer is the longer amount of time our body is exposed to estrogen. And so this is estrogen, the hormone that is made in our own body. But sadly enough, so when we get pregnant, we give our body a rest. Okay, it's a rest of all the estrogen exposure during the pregnancy. And so those gaps allow for a decrease. But the longer we wait, it can, or if we have no pregnancy, also we continue that just exposure. So the other thing is that breastfeeding has been found to be helpful. So if you're not breastfeeding, can also increase the risk. Alcohol consumption, we can definitely decide not to drink alcohol. We can definitely decide not to smoke. And we can definitely decide to decrease or cut out altogether our meat consumption, animal consumption, animal fats, etc. Okay? The things we can't control our age. So we know in some women naturally that the more you age, the increases your risk of getting breast cancer. So you can't control that. You can't control your family history. You can't control all the people in your family that have sadly had breast, ovarian, pancreatic, male breast cancer. You can't control any of that stuff. You can't control your genetics. You can't control when you start your menstrual cycle, right? So the people with earlier menses, again, more estrogen. Late menopause, you can't control that. The longer that until your menopause comes in, if it happens later, that just means more time with estrogen. And of course, if you have a personal history, you can't control that. Or if you've had to have previous radiation, some people that have non-Hodgkin's lymphoma and other things have had to be exposed to radiation. So those are things we cannot control. And so let's talk about some prevention because prevention is always important. What are some things that we can do? Okay, we talk about just the healthy adopting a lifestyle. Of course, we know about New Start. That goes without say as Seventh-day Adventists. But in terms of just foods that we may or may not be aware of, there are phytoestrogens in soy products like tofu, edamame, etc., that help to block off these cancer receptors and help to turn down those genes and just deregulate them. Also, of course, exposure to fruit, vegetables, greens as much as possible, and cruciferous vegetables. We're talking about our broccoli, our kale, our cauliflower, our Brussels sprouts. Those are vegetables that are known to decrease our risk, the increased consumption of that. Also, we talk about fiber, and I think I listed it twice. Sorry about that. I guess it's just that important. But fiber consumption, increasing our fiber, our refuge as much as possible. Mushrooms, increased consumption of mushrooms is helpful. Beans, again, getting rid of our animal products and substituting our red meat for beans. Beans of all types, lentils, garbanzos, kidney, split peas, all the different beans you can name of and think of. There's so many white beans, baked beans, all of them would be a better decision over in terms of, we talk about protein and all that in terms of red meat, processed pork, and these things I have here on the right, eggs, the high fat cheeses, the higher the fat content is considered that what's, also continues to drive the breast cancer. The trans fatty acids, and definitely, again, I repeated the alcoholic beverages. Things that can be helpful, green tea. There's a compound in green tea that helps to decrease your cancer and breast cancer specifically. Flaxseed. I didn't mention salmon, walnuts, blueberries, but flaxseed can be seen as flaxseed also, has allows for the omega sixes and threes to help stave off breast cancer. Of course, our vitamin C, vitamin E, beta carotene. So diet rich in that. And again, exercise. Exercise is always a good thing and always helpful in maintaining a healthy weight so that you can avoid breast cancer. I just wanted to say a quick word on breast cancer in the men. Men are typically diagnosed in their 60s, later on in life. They will feel a firm, palpable mass. Again, it doesn't represent a lot of cancer, but just a word on it. Um, Usually, men also can have mammograms. If they feel it, it will diagnose it, and then they do the same protocols that can help them in terms of the treatment, etc. But again, remembering if anyone has a male in their family with breast cancer, that is kind of a red flag signal to say, okay, I need to get my breast cancer, I need to get screening sooner, just in terms of because of that family history. So don't forget about that. And the last thing I want to talk about, I don't know how I missed that, I do apologize, is about survivorship. One thing is very important is that, you know, it is definitely something that women are surviving more and more and more from, especially with the lifestyle changes, especially with um, early detection and being diagnosed in the early stages, stage zero, stage one, like I mentioned before. There are 4 million American female survivors, and sadly, there are 43,000 women that are expected to die annually. So, I think the last thing I wanted to say about survivorship that I actually had in my other presentation, but that I showed earlier, was really about the fact that there are, survivorship is kind of a daily thing in terms of, once you deal with that diagnosis, you face something, you draw near to God, and He will walk you through it. I think it's so important to say that, it is life altering, and there's a lot of different things that will change. Your perspective about everything changes, your outlook changes, the time you spend with people changes, your body changes. You may go through disfiguring treatments, and you may be dealing with lack of hormones, different things because of the change of life, and there's certain you're not allowed to use different treatments and things like that. But you know, I think the most important lesson that we can learn is that, whatever God allows in your life, it is something that He will bring you through. If He brings you through it, He will bring you to it, He'll bring you through it. And so I just want to say that if there's someone out there that is dealing with a breast cancer diagnosis and, there is hope. A lot of times, you just have to look back, look forward and kind of see yourself heal, see yourself, playing with your grandchildren, just begin to, think about how God has led you in the past and how He will guide you in the future. And, there's so much more to say on this topic, but I just want to let you guys know that there is hope. So I want to open up, for questions at this time, if they're from the moderator or from anyone. And, yeah, thank you for listening to my talk today.